I'm going to go ahead and start this evening. Welcome, everyone. My name's Laurie Davin, and I'm with NAFTA, and we'd like to welcome you to NAFTA's 2021 webinar series. Tonight, our topic is vet techs and hospice care. Our speaker is Rebecca Rose. I would like to throw a shout out to Hills and Hillary for sponsoring tonight's webinar. We greatly appreciate all of their support. And Hillary is going to speak here in a bit just to give us some information on Hills. Before we get started, just some housekeeping. It's being recorded. Your certificates will be issued in about a week. Also, if you have any questions throughout the presentation tonight, you can put it in the chat or you can put it in the Q&A. Rebecca and myself will be monitoring them throughout the whole session. So we'll try to stop and answer what's pertinent and try to keep things on track. We are due for a 1-hour webinar, so hopefully we'll be able to keep on track. But now I'd like to turn it over to Rebecca Rose, and welcome, Rebecca.
Thank you, Lori, and thank you, Hillary, for having me. It's always a pleasure to be creating new and exciting programs. And Hillary, here we go. Welcome to Veterinary Hospice. And we know that supporting pets and people is what it's all about. More clients are requesting hospice care for aging or terminally ill companion animals. Knowing what veterinary hospital care is, how to provide hospice care in the practice or home, and how to assist families in the mitigation of suffering helps ensure quality care, which is what we're all here for. For clients, feeling prepared can help ease tension, strengthen the human-animal bond, and facilitate a peaceful end-of-life experience, helping them cope better with that loss. And this is from Dr. Danny McVitie in 2014. So veterinary hospice care, we're going to be diving deeper into it.
Thank you, Rebecca. We are so excited to be able to sponsor this tonight. Hi, everybody. I'm Dr. Hillary Noyes. I am a veterinarian at Hills Pet Nutrition. I've been with Hills for coming up on 9 years now. Next month will be my 9-year anniversary with the company. My current role is assistant manager for student and recent graduate affairs, and I also work on our veterinary technician and nurse affairs and strategy. So I was really excited to partner with NAVTA for this webinar series, and particularly one of my passions is old dogs and cats. I'm a big sucker for the seniors, and so hospice care is something that, I think as a profession we've been doing for a long time. We just haven't always been calling it that. So I'm really happy to see this get talked about more. And so much of this nursing care obviously falls to techs and nurses, and y'all are such an integral part of the human-animal bond, which is Hill's mission as well. So I don't know how many of you know this, but our mission statement is to enrich and lengthen the special relationships between people and their pets. You notice there's nothing about nutrition in there. There's nothing about selling pet food. It's all about that human-animal bond and making it stronger and longer. And this just fits in so perfectly with that mission that, Rebecca will talk a little bit later, and maybe I'll chime in about how nutrition fits in more specifically with hospice. But just as a topic, this is something that we care very deeply about, and keeping pets and their people together longer and happier and healthier. So I will shut my trap now and let Rebecca actually teach us something about hospice. But thank you so much for being here.
Again, thank you, Hillary and Lori, for supporting this. So I am Rebecca Rose. I'm a certified veterinary technician. I've been in the veterinary community for a long time. I graduated from Colorado Mountain College in 1987. You guys can do the math. That's a long time. I have been the past president of the Colorado Association of Certified Veterinary Technicians and even NAVTA. I'm on the NAVTA Wellbeing Task Force. I'm an author, a speaker, and the list goes on. Most importantly, I am Nana Rosie. I have 3 grandchildren, and I'm very proud of that. In the chat and in follow-up recordings, you can find the PDF of these slides and also all the resources that I'm going to be talking about on my website at catalystvetpc.com/veterinary team in animal hospice care. And it will be there for the next upcoming weeks. So feel free to go on to that site, and Lori will be sending out information as well to download and find these resources. I feel that's equally important to all of us. I am the veterinary outreach specialist for Lap of Love, and one of the reasons why I became so involved in this is a story of Tika, and I'll be talking about her throughout this program as well. Our topics today will include pet hospice care. Simply, what is it? Reviewing the guidelines. I think that's important, especially for veterinary technicians, to know where to go through to for these resources. Discussing the interdisciplinary team and who's on it and why, and why do we need so many more people? Well, you're going to see pretty soon. And then even looking at efficient and effective delivery. Now, that aspect is actually going to be peppered throughout the program. So take a lot of these chunks and pieces and a lot of resources, which are going to be downloadable articles, and bring them to your team. Help bring this conversation to your veterinarians, to your practice manager, and to your team, and even broader into the veterinary community. We simply know it takes many skilled, passionate, and compassionate team members to make end-of-life care go around. Now, my business of Catalyst Veterinary Professional Coaches simply has this logo as its piece because it does. It takes all of us, and even more so with the hospice care, with the interdisciplinary team. So what is it? Hospice care is a form of healthcare specifically designed with the goal of reducing pain and increasing quality of life for terminally ill patients or patients where death is imminent. So yes, we do think of those gray muzzle-faced pets, but also know that there's plenty of other, unfortunately, diseases and opportunities for us to offer hospice care, even for maybe that young puppy with distemper, or an older or an animal with diabetes. So many different reasons. So it doesn't have to just be these senior geriatrics is what we think about, but there's other places as well and other diseases as well. Good hospice care treats not only the painful symptoms, but encompasses mental, emotional, social, and spiritual health and well-being for the patient and those in close relationship to them, like friends and family. Now, this is from Claire Primo's article, Hospice Care in Veterinary Medicine. It's one of the links, and I felt it was awesome. This article is well written, it's easy to flow, it takes a very high look at what is hospice, but I think it introduces it very well and something that you can use maybe at an upcoming team meeting or along those lines. So loving up on those gray muzzles. Oh my goodness. I know we've all had them. We've maybe grew up ourselves with gray muzzled pets. But as Hillary mentioned, we have these soft spots for them. We know that their lives as pets and companions are so much shorter. And the joy and the compassion that we have for them is just growing in leaps and bounds. I can remember I had Mitzi as my first pet, and losing her when I was probably about 14 years of age. So think about even these family units to include the children as well. This is Tika here in the middle, who we will have more stories on as well. So thinking about seniors and geriatric pets. All right, we're going to go into the chat here. So Lori and I will watch. Simply answer for me, because most of us do know that there's this kind of like this set package for senior pets. At what age do we start thinking about senior pets? We have packages for blood work, and how do we start to introduce those ideas as a senior pet? At what age? In the chat, I see some people are putting it in there. Yay. Let's see what we got going on. We've got 7, we've got 8. Absolutely. 7+, absolutely. So that's true. And I can remember in the marketing as being that technician and working with the hospital manager that we have this package. So as a team, we started talking about at 7 years of age, this is how we're going to introduce this idea. This is how we're going to have the messaging across our team. Well, now let's think too about these geriatrics. So another question for in the chat. Oh, although first, this big black Labrador with the big eyes saying, hey, who called me old, right? They don't seem old yet as seniors. Matter of fact, they're oftentimes still very active. They're oftentimes still going on those walks and enjoying having a great quality of life. But at what point do geriatric pets become fragile? At what age does that happen? This is more objective, probably. But in the chat, tell me, when do you see that fragility that's aging at that point? We've got some folks coming in. Aha, we've got dogs, different ages for cats and dogs. Dogs about 7, cats around 12, 11 to 12 years of age. Absolutely. Again, another question that we can even be asking our team members just to get the ball rolling, to get this conversation started with our team. 10+. Awesome. Thank you for participating. Generally, between 11 and 12 years of age. And we're absolutely right. We do see differences from cats to dogs. We do see differences in larger breed dogs versus smaller breed dogs. So these are all times to consider that geriatric transition. So what do these pets look like? You've seen them, you love up on them. I actually reached out to my folks in my Facebook page from Veterinary Teams Living Well, and I asked for their gray muzzled photos. So the majority of these photos are from veterinary community, and team members were happy to send it in. It was actually a very joyful thread for a long period of time. So these geriatric pets, you've seen them. You've seen them as they start to have and require more maintenance. They just do have a level of fragility. And I thought that was a great word. They become more fragile. We see that. We see it all the time. They need to have that cautious walk on the tile floor. Even think about your veterinary hospital. They come in and they splay out unless we put them on the rugs. So even as we are seeing more geriatric pets, I'm going to give you some statistics here shortly, but how can we better serve them even within our veterinary hospitals? Geriatric pets, their eyes are hazier. Their hind limbs shake and the lack of strength is there. Their coat lacks that luster that it used to have. And we just see this. Oftentimes they'll come in and you can smell the difference between that senior pet and that geriatric pet. The blood work may or may not be normal. There could be evidence of arthritis on the radiographs, and even changes are occurring. The owner sees it. The owner is starting to prepare for it. And as we need to start having these conversations as team members with these pet owners at this point in time as well. There can be restlessness and even anxiety. That's exactly what Tika went through. She would even think, she would see a garden hose and just start to tremble like nobody's business, as one example of what she went through. And there is definitely cognitive dysfunctions that do occur. What do you see within your geriatric pets? And how can we help everybody on the team identify them? Our receptionists, our assistants, so that we can start having these open conversations in end-of-life care and hospice care. We do talk about quality of life all the time. We talk about quality of life when that puppy comes into us, and what does that look like? The exercise, the diet, what to expect the first few years. It's exciting, it's full of celebration, and we see them hopefully twice a year from there on out. And then we start to see that decline, and I'm going to show you statistically what that decline even looks like. But we talk about the quality of life and what we'd like for and feel comfortable in is talking about the quality in death as well. That might hit you hard in your heart or your stomach. This is, again, Tika and my son, and they are very healthy at this point in time and living life large, going on hikes. My son was in college at this period of time, and he and Tika were great, great friends, great quality of life. Tika loved to play ball. She would play ball until she was exhausted. One of the things she loved to do. We lived in the mountains. She could go all day long. That was her quality of life. And helping pet owners and caregivers moving into that geriatric stage really know and understand and define what is that quality of life. Because as we transition into the geriatrics and the end of life care, we need to really be cognizant of it and bring that conversation into our purview faster. So hospice is enhancing the human-animal bond. Amazingly enough, it truly is. We have years with these pets and companions, and we know when we bring home that puppy, that this puppy is probably only, or kitten is probably only going to be with us for 10, 12, 15 years. I did that just the other day with Zorro, my new kitten. I haven't had a kitten in forever. 30 years I haven't had a kitten. He's a COVID kitten. And so when I picked him up and I'm holding this little kitten and I'm realizing, oh my goodness, this kitten is going to be with me until I'm 70. Those are the kind of things we think about. So it's difficult sometimes for us as team members to talk about that end of life care because maybe one, we're not so our own personal mortality. You know, I'm going to read a quote here from this is Claire's article, and I just thought that this was fantastic. I generally don't read these things, but I just felt that this was so clear and concise and profound that I feel I'm going to read it. Remember how we were talking about the senior package and now we're transitioning into the geriatric package? Do you even have anything like that? Have you even talked about it? So there is no package that fits what is happening here. And you're feeling confused and alone, talking about the client. Questions are popping up in your head like, how do I know this is my pet in pain? When is it time to euthanize? And what will that look like? What's normal? And how can I help them help until then? These questions beget more questions. And this experience is a stark difference from the one we had when we brought that puppy and that kitten home with us, right? The contrast in support between early life care versus end of life care in veterinary medicine is drastic. Not because we do not value senior pets or know how to care for seniors, in fact, quite the contrary. Instead, the disparity is likely related to a multitude of reasons, including our own fear of mortality and discomfort in talking about death. Evolving views of companion animals from property to family members and advancements in veterinary medicine allow for our pets to simply live longer lives. I just felt that that's profound. And isn't that a great way to start even a conversation with our teams about how are we going to make this end of life care better for our pets, our clients, for us, even as a team? So many times, even just stating the word hospice can bring relief to pet owners. Hospice includes the discussion of support for all involved through the process of humane death and assists through the grief experience. I think you're seeing a trend here. We've all managed the pet's medical existence and well-being and wellness. And now, yes, we've had conversations with our clients and we've supported them, but the hospice takes it even to the next level of support and care for that client and that family. So let's review the guidelines, because I know as veterinary technicians, we want to know, what does the AVMA say? How does AHA approach this? And that's what I'm going to show you. And these links are all on that page that I've provided. As stated earlier, this is simply geriatrics beyond that senior pet is a growing population of patients. One of the surveys I read, and it was from Vet Success, it was their 2018 survey. I'll refer to it again in the future. Upwards of 30% of our patients are geriatrics. And what's sad is that we're not always seeing them at this point and stage in their life for many reasons. But 30% of our patients, this is a good clue to say, hey, for our team, what truly does that look like for our patients and our clients, and how can we better serve that population of our patients? They need that care just as much as that 5-year-old, that 7-year-old, that 10-year-old. So these are the snippets from the American Animal Hospital Association and the International Association of Hospice and Palliative Care guidelines on animal hospice. It's a much longer document. I'm just pulling out some of the top pieces I felt that was really hitting home for us today. So animal hospice is a philosophy or program of care that addresses the physical, emotional, and social needs of animals in the advanced stages of a progressive life-limiting illness or disability. Animal hospice care is provided to the patient from the time of terminal diagnosis through the death of the animal, inclusive of death by euthanasia or by hospice-supported natural death. These might be terms that you've never heard before. Animal hospice addresses the emotional, social, and spiritual needs of the human caregivers in preparation for the death of the animal and the grief experience. Animal hospice care is enhanced when provided by an interdisciplinary team approach. And again, this is just a few snippets out of a very long document. I've read all of it, and if you're already curious and interested in hospice, I strongly recommend you read the entire document. So the palliative care might be a new term. This is an interdisciplinary medical caregiving approach aimed at optimizing quality of life and mitigating suffering among pets with serious complex illnesses. I just love this little guy taking out his boat ride. Has a gray muzzled eagle. I just love this picture. So palliative care is a holistic approach, including the family's emotional engagement as the caregivers and consideration of the pet's needs during end of life. So this is a broader, holistic approach to what are the needs of that family in this end of life care. And even the idea of a natural death. Many owners fear their pet passing alone. They want to be there for that. And then that also has to have the answer, when is it time? How do we help them choose? How do we give them the tools to determine that? And for different reasons, some families are against euthanasia, and it's not for us to judge that either. It's good to remember that Mother Nature doesn't always have a better, less painful plan. This can be helping them to determine that, yeah, this is on us. We need to make this decision. And that euthanasia means good death. I know probably a number of you on this call have already had this conversation with pet parents and clients. When I worked at Town and Country Animal Hospital in the 80s and 90s, I've been a veterinary technician that long, I had this conversation frequently. I actually felt I was pretty good at it. I have veterinarians and team members tell me under their breath, it's like, Rebecca, I'm really good at this. And I'm like, great, this is an important aspect of the life cycle of our pets and our patients and our clients. We need to be good at this. We need to be good at this for the pet's sake, for the client's sake. It's okay to be really good at end of life care. Matter of fact, it's more than okay. I know that people are growing into wonderful, wonderful careers in this, and that is fantastic. It's why I'm here. We also do know that dignity and love is what all pets deserve to the bitter, bitter final end. And it's better to help a friend a day too early than a second too late. And this is actually from the Lap of Love brochure that is in many veterinary hospitals' lobbies. I just think that's so important. It's better to help a friend a day too early than a second too late. And I think, you know, if we help pet parents and families understand that and ease that suffering and ease their anxiety about this, I think we're doing a good thing. So on to this idea of the interdisciplinary team. Who in the world is it? It's a big word. Why do we need everybody? Well, because we're embracing the family. We're embracing all that is involved in the caregiving. Now, the interdisciplinary team supports not just the patient, but the unit of care consisting of the pet, human family members, and the other pets in the home. And this is from Cherie Busen. She gave this Animal Hospice 101 class during the International Association of Hospice and Palliative Care. I know that's a long acronym. I was actually the advisory board, the veterinary technician on their advisory board for 3 years. But this picture, and I'm going to slide over this. This picture is of Ruger. This picture is of Josh, my son-in-law, and that little girl down there is my granddaughter. So we too know that Ruru is probably going to be one of her first experiences with the loss of a companion, a very dear, loving pet to her. And that's why we do this. So the interdisciplinary team. The central to the modern concept of animal hospice is the interdisciplinary team. At its core, that team consists of the veterinarian, the credentialed veterinary technician, and the mental health professionals. Mental health professionals are counselors, grief, pet loss grief support systems, and the list goes on. I'm going to dive in deeper shortly. Other professionals, this is not the exhaustive list, can be included on the team: pet sitters, groomers, pharmacists, religious supporters, assistants, receptionists, and even cleaning services. And I'm going to give you another slide too to see this in a different way. But this is starting to show you what it takes to support end-of-life care for the family as caregivers. Not just us. We feel we've been doing a pretty good job, and we do a great job in the medicine. And now we're having to step in and find support from other people outside of our profession. There are many tools for this success. These evolving guidelines are part of this. This falls into helping the efficiency and efficacy of end-of-life care. Creating job descriptions. We're touching on some of that today. looking at state and federal laws, what can and can't be done within your state regarding scope of practice, roles of these team members in this, and evaluating and improving upon your hospice services. These are some of the tools for that success. So these are staggering geriatric statistics. And that's how I felt when I first saw these. I was like, wow, oh my goodness, we can do so much better with this. So I'm hopeful that that's how you're feeling about this as well. And I'll stop pretty soon to look for questions. If you have any questions with the conversation we've had thus far, let me know. We're right at 30 minutes, so we're doing great on time. But these are the staggering geriatric statistics. They were from a veterinary practice news article. And as I stated before, Vet Success in 2018 has data that shows the largest group of pets fall into the geriatric category, over 11 years of age for cats and dogs, because we're doing such a great job of educating clients. The compliance is good. Our pets are living longer. As Hillary has said, that is part of their mission as well. Keeping that client and that pet bond, that animal health, human animal bond alive. We are doing this really well. And we are growing a wonderful pool of geriatric pets. Now it's time to help our clients with that end of life care. So the next percentage of pets that had visited the clinic within 18 months of euthanasia, this is the staggering statistic. So this shows that 23% of those pets that were euthanized had come in for the veterinary clinic within 18 months. That means 77% of pets that were euthanized had not seen a veterinarian or been in the clinic for over 18 months. This, to me, is a travesty. And that's why getting this information out and supporting these pets in end-of-life care and helping the pet owner, for whatever reason, see that we're here for them for this, that's our next challenge, our next biggest challenge for our veterinary community. I wholeheartedly believe this. So this statistic shows, hold on a second here, that for dogs, 31% that were coming in for that euthanasia had seen and been in the veterinary clinic 18 months prior. 69% had not been into the veterinary hospital within the past 18 months. So I feel that that is staggering. So let's see. I'm going to look at my chats and see if there's any questions that we have. Not yet, but please, if there's anything that you have as questions about some of the things I'm talking about, please put them in there. We are happy to address them throughout the next second half of this program, and definitely at the end. So does anybody else find these statistics staggering or needing improvement? All right, what I'm stepping into next are the roles within our veterinary hospitals for the veterinarian, the credentialed veterinary technician, and others on our team. I'm going to move this over here. I apologize. So the veterinarian, thinking about what their role is. We know that veterinarians prescribe, they diagnose, they initiate that treatment, and they set that treatment plans. And we're going to even enhance that for end-of-life care, knowing that they are the expert in palliative care and pain control for terminally ill animals. This is their role. And that they are the ones to fully support the hospice care. we as technicians are here, and you'll see in other support, but they're going to really be the driver of this. They're going to be the expert for that humane euthanasia and even natural death. The developing the patient-specific end-of-life care treatment plan falls on their shoulders, and we are going to lean on them for that. They are the balance between the 4 bioethical principles and adjust the treatment plan accordingly. That's the role of the veterinarian in the end of hospice care, end of life care.
Rebecca, we have somebody in the chat is asking, or they're saying, do you think that if patients had come in during those 18 months that euthanasia could have been prolonged?
Possibly, you know, we're here to help the decrease that pain and suffering, but I think what we could have done is possibly increase that human animal bond and helped to create a healthier, happier, softer end of life for them. So there's so many circumstances that may have been improved had we done that, and we might see some of those changes and some of those ideas enhanced in the next slides. I think I believe that as team members, oftentimes we see these geriatric patients and we're not sure what we can do for them. We don't have the time often to ask them what's going on at home. You know, how is the mobility of that pet? Oh, this is a good segue. These are the 5 freedoms that are available to pets that even from animal shelters is where this came from originally. But the 5 freedoms for all animals and things that we want to help support, even though during those last 18 months or longer, is the nutrition piece, the nourishment, alleviating nausea, vomiting, the consumption of the food that's best for their bodies, and even the water until the body no longer needs them, the appetite and hydration assistance if appropriate, more care in external comfort. These are the parts and pieces that we may be able to help if we know and understand what's going on at home. Changing the environment to make life easier for the client and patient. Remember how I talked about the splaying, mobility, pets walking on tile versus putting out the carpets, and even some pets lose incontinence, and how can we support them if that's something that the family chooses to support and be caregiving in. The internal comfort, alleviating the symptoms of pain. A lot of these diseases are painful, and we know too that cats especially are really good at hiding with the pain. So alleviating the symptoms of pain, distress, and disease. The enrichment, modifying activity to alleviate boredom and allow for as much normal behavior as possible. The peace, alleviating that stress and anxiety. There is, I saw definitely the cognitive dysfunction that Tika went through, and that was just so heart-wrenching. So these are things, if we have earlier conversations, that we can help to bring to light, to help at home during the end of life care. So let's look at some of the things that I feel the credentialed veterinary technician can definitely support. Now, this is just a short list. I believe there's so many more, but our credentialed veterinary technicians definitely have that enhanced communication skills and empathy for patients and clients, especially as they can begin to move into caregiving for these geriatric patients. When applicable, veterinary technicians can offer home care, treatments, and respite services, all including those accurate record keeping, Now remember, some state laws do vary, but would fall under the indirect care of a veterinarian supervision in a lot of cases. Credentialed veterinary technicians can do in-hospital and in-home caregiver consultations and improve and assess the quality of life. They can do patient progress reports and even patient triage. You know, this is what we're trained to do. We are the hands and the hearts often of the veterinarian, and we can certainly continue to be the hands and hearts in end-of-life care. Supporting in the nutrition, mobility, and rehabilitation. Pain management and recognition of it. Are they doing better? Are they doing worse? Helping the family fill out that quality assessment and some of these other things I'm going to discuss in the future here. Symptom and comfort care management. Understanding the terminal illnesses and the death. You know, we are empathetic to the grief process. And this is certainly places that we can all improve upon as well. In some states, we can, as credentialed veterinary technicians, perform euthanasias. And we are also able to talk about body care. So these are some of the things that I feel that we can really become instrumental in. If we're not already doing it, how can we become better at it? The veterinary assistants and the receptionists definitely have roles in scheduling the hospice appointments. They do take longer time. And if they're even within the veterinary hospital, we need to allow for longer appointments. The communications and building those relationships, filling prescriptions, assisting with the outpatient care and the comfort care, and even referring pet loss and grief support. In my experience so far, going into veterinary hospitals this past few months, the receptionists and the assistants are even fielding these questions about referral and pet loss grief and how do I find help beyond the veterinary hospital and community. There is a growing number of veterinary social workers. I think that's really exciting. So continuing down this interdisciplinary team, it includes veterinary social workers, mental health professionals, and counselors. And when we aren't comfortable with what's going on and we've tapped out our resources, it's perfectly fine and okay, as you know, to use these referrals and use these abundance of resources for these families. In grief and pet loss, the bereavement that they're feeling, the caregiver fatigue, which might be beyond our expertise, but certainly these folks in the veterinary social working sphere, they're all about this. They understand it. Animal assisted interactions, and there truly is a growing number. I went on LinkedIn just the other day just to see. I plugged in veterinary social worker within my 5,000 connections. There were quite a few with this wonderful skill set. I was like, this is fabulous. In all realms, in private practices, in university settings, all different aspects of our community.
Rebecca, someone's asking, what do you do when the owner disagrees with the tech about increased pain?
That the technicians recognizing it?
Yes.
Mm-hmm. So, you know, we take it on as an attack. It's like, oh my goodness, how dare they? But we have to go back and understand, well, do they know what the animal was feeling before? Can they describe the actions that they were feeling before? Because we know in our experience that pets are really good at masking pain, especially those cats and some of these other patients. So it's building that confidence and that trust and helping them say, well, you know, well, tell me more about this, instead of taking it as a insult or being a little more empathetic possibly as to why do they believe that? What can they tell us a story or give us indications of less pain? Is there something that we can pull back on, maybe looking through those records, knowing that in the past, I have records that this has happened, and is that the state that it's in right now? Did that help to answer that question? You know, oftentimes it's building that trust that we've had in the past and recalling the conversations that we've had or been written in the records as to, well, 3 weeks ago he was doing that. He's not doing that now, it might be the pain. Or doing flexions or something. Is that helping?
Yes, they said yes. And somebody
Good.
else is asking, how do you go about referring an owner to a health professional after the loss of a pet?
Oh, that's a great question, and I'll go ahead and answer it now. Again, being very empathetic and understanding that, you know, I have been able to help you thus far. I can see, that's always a really good bridge, is to say, I can see that this is causing you a lot of anxiety or frustration or pain, whatever you're seeing in them, use that and say that I have information for you that could help you if you'd like. Here's a list or a brochure. And if they may not be comfortable ready, but it's always good to have those brochures or information, or maybe you can even have a testimonial of somebody that's been in the past. You know, we have a client that has gone to this support group and they've had only good things to say about it. But oftentimes we know those clients, we can see the stress that the discomfort that they're feeling. You can just reflect that back on them and be empathetic to it, and then offer some resources. Hopefully that helped. Great questions, fabulous questions. So, so right now we're still in the interdisciplinary part of this, and managers do play a role in this. I feel that they can help in the development of the team in end-of-life care, seeing that there's a need for it, evaluating how it's being done, designing that hospice consultation, advocating for the inclusion of interdisciplinary teams, like we're talking, even helping our team understand and being able to pass that baton on to counselors or grief support, or even having the information on our website as well. Definitely marketing. How can we show that this is an important end-of-life care is a phase that life stage that we want to support, practicing the efficiency and the comforting aspects of it, creating a comfortable environment, knowing the laws and ethics related to hospice and palliative care, having those resources in pet loss and grief, and messaging for our teams so that they know how to help in these cases. There's a certification in animal hospice and palliative care as well. So I'm going to give you a list again of people that could be considered interdisciplinary pet sitters, or on the interdisciplinary team. Pet sitters, pharmacists, nutritionists, massage practitioners, acupuncturists, chaplains, pet bereavement and loss, counselors, and body care experts. So who knew, right? Oh my goodness. We've just tripled, quadrupled the amount of people that we can help support these families during end-of-life care. So now I'm moving into the efficient, effective delivery. Now keep in mind, again, it takes many skilled, passionate, and compassionate team members to make the end-of-life care go round. So dealing with end-of-life treatment is an emotionally fragile time for pet parents, but guiding them through this phase can be rewarding and also provides valuable medical care to the pet while strengthening the bond your client has with your clinic. Isn't that wonderful? So this was a quote from my veterinary Teams Living Well folks. They said, "This perfect girl was in her mid-teens and outlasted everyone's expectations for hospice. She was paralyzed, incontinent, partially blind. She had transitional cell carcinoma, and the list goes on. She was the most incredible hospice dog, resilient, sweet, and tenacious." So as a team, having this conversation is important. And how do we as a team promote this? I feel that within your clinic, agreeing that a case deemed hospice allows the family to elect euthanasia at any time without needing to defend their choice to say goodbye or without judgment. And how would your team handle that? How would you support them in this? And helping all of our team members understand this, answering the question, when is it time? Well, looking at the quality of life, helping them create that bucket list of what the pet would like to do, understanding, coming back to that previous question about what have they done prior to the pain, and how have they lived that life that was so wonderful? Remember, I talked about Tika playing with the ball and so many other things that were her quality of life. And when I saw her just being so distraught about even a garden hose and jumping and living in the bathtub, just at the slightest of noises, oh my goodness, it was just so distraught, but so full of anxiety for me as well. But helping those clients and together as a team with the messaging of pain and suffering, and then helping to support that owner and the family in their choice. Having this as a team conversation and building this out together. And also including the quality of life for the family and them being the caregivers. And I looked at this as being that caregiver budget. The finances, this is taxing in so many ways, and the time that it takes for end of life care. And yes, we have the expectations for that and setting that for them perfectly upfront and being transparent in it. But there's a physical aspect too. We may be showing them how to do in-home treatments. And even though we show them and give them the best possible way of doing it, maybe they just can't do it. And simply the emotional bucket as well. All things to consider during this end of life care, blending the caregiver's role in this as well for the family. So I looked at this map with Mary Gardner. She's the veterinarian that is one of the founders of Lap of Love. And I thought this was fantastic. I think this is probably going to be one of the best slides that you guys might be able to use in the future when you're assessing this. So think about this. Now we're talking about a euthanasia visit, building up to and already having all of the end of life care and supporting that pet through those final stages. But even the end of life for me with Tika was important. And so even consider this and use this map for you and your team. What does that look like on the phone call? How can we prep for arrival for that last visit? And is it appropriate for us to refer it out? Because there are a number of resources and services that are being done in the home. What can we help your clients at time of arrival? How can we help them while they're in the room? There's full-blown seminars on how can we make that environment lovely and supportive of those families. For Tika, I'm going to show you in a minute, we had many family members in a short little room. If in-home hospice or in-home euthanasia would have been an option for me, I would have certainly have preferred that. When do we take payment? Do you charge for the euthanasia service at all? Something to consider as a team. allowing for that added time for that service. The veterinarian or the team members coming in and explaining what's going on in this process. Is there the sedation, the euthanasia being administered? When do you offer memorial items? Maybe that's a conversation that needs to be talked about at the beginning when we're first setting the appointment. How are we going to help these patients and clients and family members exit, and the follow-up and aftercare? So for me and Tika, this was Tika. She passed away in 2012. Tika Louise, she was my sidekick extraordinaire. We did quite a bit of things together. So when I was making the most of it, I scheduled her appointment on February 15th. It was a few days out. We had already gone through a number of, as I said, cognitive dysfunctions and the hair and the skin. And oh my goodness, it was just so disheartening. This is her last car ride. She got to do whatever she wanted. We had loads of popcorn. We went for a walk. We did all the things that we needed to do. I made arrangements for communal ashes beforehand, had all of that taken care of. I paid ahead of time. My son wanted to be there. His girlfriend was there. My husband and I, we all attended in this small little room. We chose to leave her there, and I took ink pads and we took ink prints of her paw. And later on in the spring, my husband and I took those to her favorite place. But how can we, especially in this moment, make this the best final human-animal bond experience for those families and for our team? That's the whole question. How can we do this better? You know, for Tika and I went well. I maybe would have chosen to have her at my home if that was an opportunity. So remember too, that grievers need to feel their feelings in order to get to the other side of grief, and you can enable that moment. This is from Carolyn Shadler, again, from a class that was given at the International Association of Hospice and Palliative Care. Now we have 5 minutes left. So there is value in empowering everyone on the hospice care team to reach their highest potential. By empowering the entire team, compassionate client and patient care can be elevated. So I'm hopeful that we gave you some new tips and tricks. There's all the links and resources on my page, catalystvetpc.com. Veterinary team in animal hospice care is where you can find everything. So at this point in time, we can open it up for questions and chats, and even Hillary or others on the line can make their responses as well. Hillary, how did that go for you?
Oh, Rebecca, you're wonderful as always. You know, you really got to the heart of it. I loved seeing kind of specifically how everybody in the hospital is part of hospice care. It's not just the veterinarian. It really is a team effort. And I think that's so important because clients have so many questions, right? And it's really, these things can change day by day, minute to minute. I've had, we've lost 2 geriatric cats in our household in the last 6 months. And, you know, things change so quickly. And we had Lap of Love come out for the first one. Luckily, we had a little bit of notice in order to schedule that. But the second one was just too quick for that. And, you know, it was so wonderful to be able to have those resources to ask questions of, because even as a vet, when it's your own pet, your brain just breaks, you know, you can't think objectively. But what helped us was having the resources and the vet team to help us through those thought processes ahead of time. if this happens, we're going to make this decision. If this happens, we're going to make this decision. And that really helps. So yeah, wonderful as always, and I will just put in another plug here for the role of nutrition, of course, in these patients, as we know, as they get older and sometimes sicker, their appetite tends to be the thing that is a big struggle and is often what, rightly so, owners and the vet team look at to determine quality of life in a large way. And so, work, I'd say as vet professionals, think about all the options out there, learn about all the tips and tricks, work with your food reps and the vets that are at your food companies, Hills and others, to ask about those tips and tricks on how to keep pets interested in eating, because it's not just, oh, they're not eating this food anymore. We have stews and there's flavors and sometimes just that variety, and clients, what's second nature to us in terms of getting a pet to be interested in eating is not second nature to these owners. They don't think about things like putting it in the microwave, trying a different flavor, things like that. So that's where your knowledge as vet techs and nurses and even support staff really comes in handy, because the veterinarians don't always have the time to have these conversations. And honestly, we don't always have as much knowledge as you guys do on these things. You're the ones sitting in those cages feeding those hospitalized pets all the time. So
well, and I think that's going to be my next class, are all these hacks, because we talked today about who is the team. This is a very large extended team, and we see why. We're dealing with the family here and helping them be that caregiver. And how can we, as the veterinary team, give them all of those tips and tricks, like those hospice hacks, so to speak? How can we come up with those?
I see a question in the chat from Ashton and Rebecca. I'll turn it over to you to answer, but I just wanted to throw in, because it's such an important question. How do you know when you need a hospice care team, or do you recommend every hospital have one? And I would argue that if you work in a hospital, you are already a hospice care team. You're already doing this. You're already treating older pets. You're already treating pets with terminal diagnoses and waiting for the owners and the pets to be ready. That's hospice. That's what it is.
I just think we need to evaluate it and be better at it. With over 30%, and again, I challenge all of you on this call or doing this later, find out what percentage of your clients truly are geriatric, because I think we're going to realize we are underserving them. I think ultimately we're going to realize we have a lot of geriatrics and that we could be doing it better.
Yep. Yeah, it's not just those last couple of weeks before they pass away. It's really, I count it as any uncurable diagnosis. If we're not going to euthanize that pet right away at the time of diagnosis, which we're not going to most of the time, the rest of that is palliative care.
Yeah.
Even if it takes
keeping
years.
them comfortable, helping them support them, setting clear expectations of what does this look like for the client. Again, I feel that, remember that one slide I said, how many are not coming into the veterinary hospital for those 18 months? I think it's just because they feel guilty, that they realize it's the end of life care. They don't want to do anything else because they don't know what else to do it. And we're not having the conversations. We're not mentioning, let's think about geriatric care. Let's think about hospice care.
They're afraid if they come in, we're just going to say, well, it's time. He's old. He's had a good life. And we're not going to say that. But that's, I think, what they fear coming to the vet because of that. Canine cognitive dysfunction, I think, is a big one in this space, that clients do not come in when they see the signs of cognitive dysfunction in their dogs. And there are things we can do, but those dogs stop eating, they start peeing in the house, they get confused, and people just think, well, they're old, this is what happens, but we can treat it. We can't cure it, but we can treat it and slow it down.
Yeah. So I know we're hitting the end of this, Lori. We've got the time. Hillary, again, thank you so much for sponsoring NAFTA. Thank you for hosting. I know when I do attend the International Association of Hospice and Palliative Care, the IHPC is what they call it, and their classes are going to be in September in Tampa. that's one of the things that we often talk about is how can we help veterinary teams have this conversation earlier so that we can step into hospice earlier. It could be 3 months earlier, it could be a year earlier. In that one slide, we said we saw, years earlier. Supporting the end of life care is what we and what I am passionate about. It's what Hillary's passionate about. It's so many of our missions. And let's really embrace it. Let's really advance it. Let's really elevate it.
Agreed. Thank you so much.
Thank you, Rebecca, for your expertise. And thank you, Hillary, too, and Hills for sponsoring tonight and giving us your expertise on this also. We'd like to thank you at NAFTA and hope everyone can join us next month for our next one. But we also have one coming up this Thursday, if anybody's interested. It's a webinar for standards of joint supplements. So if anybody wants to register for that, they can register for that. So if anybody has, I don't know if anybody has any more questions. Let's see. Nope, just great job. Thank you, everyone's saying.
Good. Well, thank you. Everyone can reach out to me. There's my Rebecca R at lapoflove.com. I'm happy to help and assist at any point in time. And you all are very, very welcome. Thank you.
Have a good evening, everyone. Take care.
Bye-bye.